Welcome to Apothecary Talks. I'm Dr. Stansbury. We're producing a series of short videos aimed at teaching budding herbalists the skills to create effective herbal formulas. We're taking a look at actions of herbs as an introductory topic in this video, and we're also producing a series of follow-up videos that go over each one of these actions to be further explained. Actions of herbs is a basic skill in creating effective herbal formulas, and one begins by understanding the various actions from antispasmodic to antimicrobial. From there, there's also different herbs, materia medica choices, a word meaning all those different herbs A through Z that one learns are referred to as your medical materials, materia medica, that will have an affinity for different tissues, a respiratory antimicrobial, a gut antimicrobial, a topical antimicrobial, or an antispasmodic that has an affinity for the musculoskeletal system, an antispasmodic that's wonderful for intestinal cramps, an antispasmodic that excels for uterine cramps. Those are called the specific indications. So those are basic skills to becoming an herbalist, is learning first the actions of herbs. Mastering the action of herbs is a first step to becoming a skillful herbal clinician. And in addition, we learn our materia medica, those list of medical materials of all the different herbs, and we also learn specific indications. If any have a real unique presentation for a certain type of pain, for a certain type of infection, for a certain type of presentation, that's called a specific indication. And once we learn those basic indications, actions, materia medica, we can make much more effective herbal formulas for ourselves, our families, or if you're going the whole clinical route for your patients and clients, than just trying to put together into a bottle all the different things that you've ever heard of that were antispasmodic, or all the different herbs that treat infections. We should pick and choose amongst those herbal options, those niche, specifically indicated best choices to make the most efficient and effective and practical medicines. The study of the actions of herbs is a practical and effective method of practicing herbal medicine. I say that because you can also go online and go quite deep in learning molecular mechanisms of action, and that rabbit hole is indeed quite complex. Things that affect tumor necrosis factor, things that affect cytokines, things that affect cell-to-cell communication, things that regulate blood sugar, things that affect second messenger signal transduction. It goes very deep into biochemistry if you're interested in that sort of thing, but it doesn't really make you be a better herbalist per se right out of the gate than just the old folkloric approach of learning materia medica, learning actions, and learning specific niche indications. Herbs can be selected based on the basic, quote, actions, such as warming and cooling. If somebody has a hot type of pain, maybe you want aloe gel in their mouthwash for burning sensations on the tongue. If somebody has a cold sensation throughout the body, maybe you want a little bit of ginger or cinnamon in your formula to drive it into the tissues in a way that's warming and gently stimulating to be energetically specific for them. We might want to be stimulating to deficiency states, and we might want to be sedating to excessive anxious states. We might want to be choosing antimicrobial, antispasmodic, anti-inflammatory, and so on. And then we could also look at words that are perhaps more modern than the folkloric concepts. A cell proliferator, an antihistamine. Those wouldn't necessarily be in books from 500 years ago, or some of those herbals that are classic and still quoted to this day. Now that we have deeper and deeper molecular mechanisms of action and ways to understand herbs through the lens of modern science and cell tissue culture studies and molecular assays and so on, it does get quite pharmaceutical or quite molecular, or matching more the common medical paradigm. And Those are valid methods too, but they're not necessarily more valid than learning the old folkloric approaches of actions of herbs and learning their specific niche indications. It's a kind of sophisticated pattern recognition the deeper that you go. So I'm not going to go over all of the words on this list, but these are the words that will be producing separate individual videos for most of these to talk about antimicrobials, which are antiviral, which are antibacterial, which are antifungal, which have an affinity for lung infections and bronchitis and pneumonia, which have an affinity for gut infections and gastritis, which make good skin washes for infected wounds or fungal infections of the feet like athlete's foot. Antispasmodics, again, some might have a real affinity for the lungs, for the uterus, for the skeletal muscles, and so on. Alterative and adaptogen are very important concepts in herbal medicine that really don't have an equivalent in pharmaceutical paradigm. There's no drugs that are really alterative or adaptogens. Alteratives are those bitter roots, dandelion root, burdock root, rumex root, that stimulate bile flow from the liver and support the good bacteria in the intestines, your microflora and probiotic species. And in so doing, alteratives support liver and gut health in a way that helps us absorb nutrients from our food more efficiently, as well as process our own carbohydrates and lipids, cholesterol, fats more efficiently, as well as eliminate fat-soluble and bacterial sorts of toxins, either our own metabolic waste or pesticides and environmental toxins that we're exposed to, as that is the liver's job to clear fat-soluble and toxic materials and put them into the intestines for elimination through the gut. So alternatives enhance absorption of nutrients and elimination of wastes, and that seems to help everything. So we'll have a separate course, short video on alternatives. Adaptogens are also referred to in Chinese medicine as qi tonics, helping your energy, your vitality, your immune function, your resilience, your stress management, and they believe your longevity. Those things like reishi mushroom and ginseng are in this category that help you live longer. So again, I won't read this whole list as it's time consuming, and we'll be focusing short segments to help teach the skills of all of these different actions. But as you begin learning herbal medicine and you're collecting your materia medica list, make yourself a little list of some of their primary actions. Tea tree oil would be an excellent antimicrobial. Calendula is a vulnerary, meaning a wound healing agent. Echinacea is an immune modulator. Garlic is an antimicrobial, and so on. And usually herbs will have a list of 5, 6, 7, if not 20 or more actions. But sometimes you might put 2 or 3 actions at the very top of the list. They really excel at treating infections in mucous membranes, like golden seal, or they really excel at moving lymph when there's hard, tender lymph nodes, such as phytolacca, or they really excel as an adaptogen, such as our medicinal mushrooms and the ginseng category of actions. I have written a series of textbooks, herbal formularies for healthcare professionals, that take a deep dive in all of this material. They're available from Chelsea Green, and you can look up chapter by chapter, digestive function, musculoskeletal function, and be guided in how to put together formulas for a fairly substantial list of different diagnoses and conditions and presentations. And the end of each chapter has a long list of materia medica to help guide you learn the herbal medicines. I also lead ethnobotany trips to the Andes and Amazon, and you can contact me here, bghealingarts.apothecary@gmail.com. And I thank you for listening. I have much more free content on my website, healingartsapothecary.org, where you can find links to other podcasts, as well as view my blog and free PDFs to download to continue your journey of learning herbal medicine. Thanks so much for listening to Apothecary Talks.